livelihoods of its population in a rapidly changing climate. Thank you. Sir.
Thank you, Bangladesh. Now I'd like to invite distinguished delegate from Sri Lanka.
Thank you, Chair. Distinguished delegates, Sri Lanka warmly welcomes the extension of the regional framework for action on building health systems resilient to climate change until 2027, reaffirming that climate action is health action. At present, we are in the process of revising our national health policy and the National Health Strategic Master Plan, where health, environment, and climate change have been prioritized as a core area. This ensures that the commitments in our National Adaptation Plan 2025 to 2034 for the health sector and nationally determined contribution NCDs 3.0 for health and fully mainstream into national health planning and resource allocation. Key milestones include training over 1,000 district level trainers across 17 districts to strengthen local preparedness, finalizing the National Action Plan on Healthcare Waste Management 2025 to 2034, and conducting an all-island wash baseline assessment in government healthcare facilities. We have also initiated a National Heat Health Action Plan, introduced guidelines for green, healthy, and safe hospitals, and commenced a national greenhouse gas emissions assessment of health facilities, demonstrating our dual commitment to adapting to climate risks and reducing the sector's carbon footprint in line with our pledge on building a low carbon, climate resilient health sector. While these achievements are significant, we continue to face challenges in mobilizing financial resources, strengthening surveillance and modeling capacities, and ensuring equitable climate resilient infrastructure across the country. We therefore urge WHO and regional partners to enhance technical support, facilitate access to sustainable climate finance, and share regional knowledge and innovation. We also propose the establishment of a regional center of excellence on health, environment, and climate change to provide continuous support for member states. Sri Lanka stands firmly committed to advancing the health and climate agenda in solidarity with the region. Thank you, Chair.
Thank you, Sri Lanka. Now I'd like to invite distinguished delegate from Nepal. Thank you, Chair.
Thank you.
Thank you, Bangladesh. Now I would like to invite distinguished delegates from Sri Lanka.
Thank you, Chair, and the distinguished delegates. Sri Lanka acknowledges the progress presented under this agenda item and recognizes that the resolution CHARTS, accelerating prevention and control of cardiovascular diseases in the Southeast Asia region, has played an important role in prioritizing policy and clinical interventions across the region. Sri Lanka has adopted a best practice policy to mandate limits on industrially produced trans fatty acids and had implemented 4 out of the 5 shake evidence-based measures to reduce salt intake. The country is also on the track to achieve its commitment to place 1 million people with hypertension and diabetes on protocol-based management. In view of this, the increase in burden of cardiovascular diseases driven by population growth and aging, and the urgent need to accelerate prevention and control efforts, Sri Lanka proposes that WHO support the countries to design a set of extended and expanded CHARTS milestones to be achieved by 2030, and the regional committee consider extending the resolution on CHARTS on 76th regional committee at up to 2030. Thank you, Chair.
Thank you, Sri Lanka. Now I'd like to invite distinguished delegate from distinguished delegate from Sri Lanka.
Thank you, Chair. Sri Lanka recognizes the growing burden of non-communicable diseases and its is committed to reducing insufficient physical activity as a national priority. Our current multi-sectoral action plan on NCD prevention and control 2023 to 2027 aligns with the global action plan on physical activity and targets a 15% relative reduction in insufficient physical activity by 2030, using 2015 as a baseline. To support this, we have prioritized system strengthening and multi-sectoral collaboration along with community empowerment to promote healthy lifestyle through our National Strategic Framework for NCD Prevention and Control 2023-2033. We are pleased to report several achievements. Physical activity promotion guides have been developed for schools, workplaces and higher education institutions with focal points trained and empowered across these sectors. Government ministries have initiated regular aerobic sessions, and Ministry of Health has produced and disseminated short video modules to reduce sedentary behavior in workplaces. Best practices at a subnational level are shared through biannual performance review programs. In collaboration with other stakeholders, we are promoting utilization of public walk paths and jogging tracks and developing short exercise videos to minimize sedentary lifestyle among preschool and school-aged children. Training on Zumba and yoga has been provided to further in this context to build the capacity of the health workforce in promoting physical activity. In this context, we seek regional collaboration and WHO technical assistance in two areas: capacity building to create enabling environments for physical activity, particularly in urban settings, and the development of digital tools and social media based interventions to reduce sedentary behavior, especially among adults. We reaffirm our commitment to promoting physical activity across all age groups and sectors and look forward to continued collaboration with the member states and WHO in advancing this regional priority. Thank you.
Thank you, Sri Lanka. Now I would like to invite the distinguished delegate from India.
Thank you, Chair. With an increasing prevalence
On news
Yeah.
yesterday, yeah, I think the cabinet has given the approval for the RC meeting, and hope to see you all on 30th or 12th, in fact, rather. So 12th we have after lunch session.